What do you see when you imagine the future? When we picture what's to come, we often think of innovations that take us to new heights. Some of them are already here, and every day, thousands more make the jump from our imagination into reality. Nowhere is this more evident than here in Japan. Fourth Industrial Revolution technologies are fundamentally transforming the way we do things. All this is happening so fast, and we must do more than just keep up. These emerging technologies open up boundless possibilities of what our future could look like. Technology is not a simple solution to our problems. It poses questions that we need to answer and guidelines we need to write together. That's why we're all here. A global event hosted by Japan that brings together the world's leading voices across disciplines and geographies. How technology will shape our tomorrow depends on the choices we make today. And that starts now.
Hello, everyone. Welcome to the Saving Lives with Emerging Technology panel at the Global Technology Governance Summit. My name is Yinka Adegoke. I am the Strategic Initiatives Editor at Rest of the World, a publication which covers the influence and impact of technology on countries in emerging markets and where the majority of the world's population lives. Today, I'm honored to have an excellent panel of speakers to address our topic, which is saving lives with emerging technology. I'm going to start off with introducing them very quickly. We have the Minister for Information, Communication Technology and Innovation for Rwanda, Paula Ingabire. We have the Senior Vice President for Natural and Technical Sciences at the Novo Nordisk Foundation, Neda Odesheda. We also have the Minister for Information Technologies and Urban Development of Telangana in India, K.T. Rama Rao. Thank you all for being here. It's a great honor. So this topic is an incredibly important one. If we have learned anything from the global pandemic, it is obviously the importance of our healthcare systems. But our healthcare systems also have been tested around the world, whether you were in a developing country or an advanced economy. And technology has been one of the ways in which we have seen some countries able to cope better than others. And we've also seen how artificial intelligence in particular has been used for transformative advances in many areas. Yet even as these technologies show the power they have to help countries advance, we still have to be vigilant about the gaps that appear when these technologies are developing, if you like, faster than our ability to govern them. And that's kind of what we want to address today. We want to really sort of get into seeing these examples from incredibly different parts of the world, and yet there's this common experience that they have, these common learnings that we can find that can be learned even from the supposedly low middle income countries to the advanced economies, and how we can all learn from each other in terms of how even these advanced technologies, we need a new way in which we apply them, particularly to healthcare, with the sensitivities around people's personal data and information, and generally how healthcare is delivered. So I want to start off with the minister from Rwanda to speak about the experience in Rwanda. Rwanda has been at the forefront of countries, particularly on the African continent, in terms of being a testbed for the way advanced technologies can be used to help country expand and scale its healthcare services to reach even more people. Thank you, Minister. Could you give us an introduction to how the experience has been?
Thanks, Yinka. It's a pleasure being part of this panel and, of course, discussing a topic that is very dear and close to all of us coming through, the pandemic that we're all going through, as a global family. But just to start us off and just giving you a background of Rwanda, over the several years, as a country, we've prioritized technology as a key driver for sustainable development across all the key sectors. And that doesn't leave healthcare behind. I think as we're watching the video, we did hear about how technology shapes tomorrow that makes it very dependent on the choices we make today. And I think for a country like ours, where we had limited natural resources, and we had to think about what does it take to get us from a low-income economy to become a middle-income income economy, were to think very strategically about what are going to be those key drivers for growth for us. And technology, ICT, and innovation were identified as one of the key drivers for growth for a country such as ours. And particularly when the linkage to health also is, anchored by the fact that Rwanda has also, made deliberate efforts to ensure that all our people have universal healthcare insurance. So once at least you're affording all the citizens access to basic healthcare services that are required, I think next for us as a challenge was figuring out how do we then ensure that all our citizens can have access to quality healthcare and affordable healthcare. And this is where technology plays a significant, role, especially because we're dealing with a sector that is of strategic importance to the country, but also whose needs are very infinite and the resources are finite. And so how do you start to think about, what does it take to really ensure that we, finding the best, most effective and efficient way of delivering affordable and quality access to our citizens? So our approach over time has been to strategically use technology to close this critical resource gap. And this is by increasing inefficiencies in the healthcare supply chain, such as the use of drones to deploy our national blood delivery service across the different healthcare facilities in the country. But it's also been about how we're using robots today in the pandemic to minimize contact of, COVID-19 patients with the healthcare workers, who, by the way, still, when you look at the ratio of patients and doctors here in Rwanda, the gap is still so huge. And so how do we support our frontline health workers during such a time? How are we, and also this has also been seen in how we're using AI tools to model, the spread of the pandemic that will then feed into our decision-making process of understanding the levels of preparedness that need to be put in place to really respond and deal with the pandemic. And today we're also looking at how we use AI-assisted triage tools to support universal healthcare schemes and making it easily accessible to many of our citizens. So in essence, the pandemic has only amplified the need to invest in more healthcare research and innovation, while also, giving us an opportunity to take an agile approach when it comes to regulation. And I like what you said, what happens when you have all these emerging technologies, evolving very fast, but then, what is needed from a regulatory policy perspective cannot match the speed at which innovation is really growing. So there's so much that both advanced and developing economies such as ours are learning about how to effectively use emerging technologies in healthcare settings in a safe and responsible way. And that really also brings me to something which is really around the aspect of leapfrogging. I think one of the things that emerging technologies has afforded countries like ours is the ability to leapfrog. When you don't have legacy infrastructure, legacy systems in place, how do you then, with a very, green field kind of landscape, invest in some of these emerging I think it's something that, developing countries can really, leverage at this point in time. So finally, we are partnering with the World Economic Forum on a project that will pilot the responsible use of chatbots in healthcare, bringing both regulators the private sector, the academia, civil society, to examine and inform our regulatory approach that will quickly evolve with this high-impact innovation that we see emerging technologies bring to the table. Thank you very much, Yinka.
Thanks so much for that. Excellent. I have many questions, but I'll come back to you because I really want to hear from the Minister Rao about the experience in India, because you're in a very different place. India has been, in the last couple of decades, has been at the forefront of technology in many ways. As your state in particular has been at the center of much of the advances that India as a country has made in terms of both technology and science, as we were talking earlier there about being the vaccine capital of the world, of India. But you have also made advances in healthcare as well. You have, some years ago, you passed the WHO sort of target of 1 doctor to 1,000 people, which, many in the countries in the developing world want to attain to. Many have not yet got there. So you're kind of in a different place. And I really wanted to understand what the experience has been there as you talk about using advanced technologies to really sort of close some of the gaps you're still trying to close, both in your state and throughout the country.
Thank you, Inka. It's a pleasure, a privilege to be part of this wonderful panel. I'd like to thank the World Economic Forum and the Global Tech Governance Summit. As much as I think all would have loved to meet in person in Tokyo, I think the pandemic literally has been a dampener, but nevertheless, I think it's great to connect this way across time zones, across continents. It's a lovely feeling. The one thing I'd like to point out, irrespective of whether one is from a developing nation or a first world country, I think this pandemic has brought one thing, to the fore, and that is how unprepared we were to handle a pandemic and how inadequate our medical infrastructure is. Irrespective of which part of the world we are from. It could be from India, it could be from Rwanda, it could be from Europe, America. In fact, the place where you're sitting, Inka, is where I went to school, like I pointed out, New York. Yeah. And I watched in horror when New York was reeling under severe shortage of ventilators, and Governor Andrew Cuomo was constantly talking about it. So the world's inadequacy in medical infrastructure has been thoroughly exposed. That is one thing we all can agree on. And secondly, we can't have, obviously, a knee-jerk reaction or a quick fix for everything. But I'm sure, as we all agree on this panel at least, technology can just, help expedite a lot of logical solutions in assisting us with this pandemic. Our Honorable Chief Minister, the state I represent, Mr. K. Chandrasekhar Rao, he always reminds us that a technology that does not have a direct societal impact, no matter how fancy it is, no matter how cool it is futile. A technology that does not come to the rescue of the most vulnerable, a technology that does not have a societal impact on the poorest of the poor is absolutely futile. So that is one guiding principle that we have used in our state of Telangana. And as you pointed out, Yinka, we are in fact, one of the top tech destinations in the world. Hyderabad is the city my capital city. It is home to top 5 most valued tech companies of the world. In fact, the second largest campus of Google, Facebook, Amazon, Apple, Microsoft, Uber, Salesforce, all of them are in Hyderabad today, outside of the United States. And all of these organizations are engaged in cutting-edge technology, cutting-edge research and development in my state. But we are also, in fact, as I pointed out earlier, in fact, my state and my city, Hyderabad, is also the vaccine capital of the world. We manufacture nearly 1/3 of global vaccines, human vaccines, from my city and my state. But are we doing enough in the sense of being able to handle this pandemic on our own? I think, as I pointed out, as I said earlier, we've been exposed also to this pandemic. A few thoughts quickly on what are the things that we could potentially do using emerging technologies. For instance, in a developing nation like India, as we all know, there is inadequate coverage when it comes to the rural areas, when it comes to the villages, when it comes to the rural setting. There aren't enough doctors available. There aren't enough, medical personnel available in the rural areas. How could emerging technologies and technology at large help? Solutions like telemedicine and possibly using a hub and spoke model can be a great game changer in ensuring that at least the diagnosis part and the prognosis part is taken care of. And as you pointed out, shortage of medical personnel continues to be a big problem because we are a country of 1.3 billion, India. So therefore, the shortage of doctors, shortage of nurses, shortage of paramedical staff continues to be a huge challenge. Now, how do we address that using technology? I'd say using AI-based diagnostics, using augmented reality, virtual reality-based procedures. You could have nurses, etc., that can be directly allowed to interact with the people who are affected. I'd say using solutions like IoT sensors, etc., because there's a lot of lack of awareness among people at large on how to contain a pandemic. What are the preventive measures one has to take, etc. Maybe using IoT sensors, using testing, tracking, using technologies also can be a great tool. And more importantly, logistical challenges. You're a vast country like India, where you have geographical diversities, etc. We could use technologies like drones, as Minister Ingeberg talked about, drones and other solutions, which certainly help in not only delivering blood, it could help in delivering medicines. So all of these emerging technologies, be it IoT, be it AI, be it drones, be it VR, be it AR, and I could go on. Multiple solutions. All of this, a combination of this, in fact, is what I think the world is looking at. And one very important, issue that has also been brought to the fore is no matter which country you're from, I think, as we had united at some point as United Nations, I think time has come for all of us as humanity also to start building a global database of health records, irrespective of where you are. Maybe having your health record somewhere up there in a cloud, and having access to it from across, a wide network of healthcare providers across the world, I think is a great idea. Because if you think about it, people talk about universal healthcare, people talk about a lot of solutions. In the US, I was a huge admirer of President Barack Obama when he was running the country. The Obamacare, as was talked about, as was espoused. So I think the time has come for us as humanity, because this pandemic has really, has marred all the geographical boundaries. So therefore, time has come for us to create a universal healthcare database, universal health records database, and having unique identities, etc. And just putting it up on a cloud, giving access to everybody across nationalities and across geographical boundaries. So yes, technology is a great leveler, and I think I'll say more, a few minutes later. But
yeah, that's fantastic. That's fantastic, and I am intrigued by your idea of a global healthcare database, and I definitely want us to get into a little bit into that. But before we do that, we definitely want to hear from Professor Olushade to sort of talk about the work of Novo Nordisk and how you see this space in terms of when you work with governments in particular as a partner, what the challenges are and the opportunities that you see.
Okay, thank you. And thank you very much also for organizing this very, very timely session on development of emerging technologies, improving the lives of people. So the vision of the Novo Nordisk Foundation is to contribute significantly to research and development that improves the lives of people and sustainability of societies. In particular, we believe that progress in emerging technologies, in particular those on digital platforms, underscore progress in any other area, that be health, wealth, education, and general human well-being. So with this, I would like to give a few examples of how the Novo Nordisk Foundation has contributed to saving lives with emerging digital technologies. And such technologies do have a huge potential because smartphones are very widespread throughout the world. We may as well take advantage of this. So one such example is a so-called Safe Delivery app, which is a free mobile application that guides health workers in how to handle the most common childbirth emergencies. And this can be used straight from any phone or tablet. It comes in several key global languages, as well as country-specific versions, and it's actively being used in more than 40 countries. The purpose, of course, is to minimize death of mothers and babies in connection to childbirth. So another such digital platform, which we will believe will save lives, is the so-called Digital Compass. It's completely new, and it will provide free, simple digital support to healthcare professionals and to help them prevent, diagnose, and manage diabetes. So, but in order to use these digital platforms, the most important point that I would like to get across this is that in order to take advantage of such digital health transforming technologies, it is very important in every single country, regardless of where it is in terms of income, that data privacy and security must be prioritized and respected. Data is valuable, and care should be taken so that data is not exploited. And this is not only health data, it's any type of data. Also, there is a need to establish public-private trust relationships. This would also enable countries to perform citizen-based digital research, which is very important to improve the health of people. There must be digital access for everybody, and internet connections must be made available at a fair cost and reasonable quality. In addition to this, there is a need for digital skills in the population, and this must be achieved through education and training that builds upon transparent and trustful relations. It is also very important to build local capacity in data science. And this is because it's important to mitigate the dependence on importing such knowledge, and also to mitigate the effect of brain drain. So also I would like to support Minister Rama Rao in that international collaboration is very important in this space. And international collaboration is the only way in which we can address global challenges such as the next pandemic, which will reach us at some point, or the climate changes which we are also facing. And in order to do this, we must build a trustful atmosphere in how we deal with data.
Thank you very much for that, and you definitely ended there with some of the topics I want us to get to, because they're just key to everything about this. Because it's all very well for us to have these great ideas and these great plans. I mean, when I say us, I mean people who are decision makers in governments, and partners to governments, but there definitely needs to be a sense that decision makers are taking into account ordinary citizens, how they feel about these things, and to build trust in everyday citizens. Even those of us who sometimes feel we are well informed, we are also kind of suspicious when someone asks to know where we're going, so we know who the next person who we've been in contact with in terms of COVID. We when this thing pops up on your phone, you look at it and you wonder, well, why do they need to know that? And it's kind of important to understand how governments go about thinking how to build that trust. So let me frame the questions. Let me start with Minister Ngabire. I will just go straight into that issue of privacy. Could you talk about how you've planned for protecting data and data privacy and any sort of considerations or peculiarities that are peculiar to your country that you think other people could learn from in your experience as you started? Because I imagine you're still somewhat at the early stages of building this out, and maybe there are lessons that we can learn from that.
Absolutely. So, Yinka, I think for us where we are as a country is currently, and again, thanks to the World Economic Forum and various other partners, we've been able to put together, quite a comprehensive, but also what I believe is going to be a progressive data protection and privacy law. This didn't exist. We had multiple instruments that were trying to cater for different aspects of privacy and data protection, but nothing as comprehensive that has been put together. But needless to say, of course, this is a common challenge that many of the governments have been facing, many jurisdictions are facing. I think what was important for us and what was at the back of our mind as we put together this law was thinking about the need to protect personal data, which is really from our constitutional perspective, it's a basic right for many Rwandans that their data is protected. However, at the same time, we were faced with the fact on how do we, ensure privacy and protect data. At the same time, we also have a mandate of promoting innovation. So these things, in many, cases, can be there could be tension between them, because if you have a very large piece of legislation, chances are that the amount of innovation that you start to see in the society and the jurisdiction is really enormous. But if you have a very restrictive one, then there's the downside that then you constrain how much innovation that can happen. So how do you strike a balance? And I don't think there's a magic approach to balancing regulation and innovation. But I think everything is about how do you test and try out many of these things. And you earlier touched on the fact that Rwanda has become a test bed, and that's a strategy that we have, we've embarked as a country to be a proof of concept hub. And interestingly, digital healthcare being one of the key areas where we want to promote innovations and proof of concept kind of innovations where they can be tested here, tried, and if proven successful, we start to see how they can be scaled, not just across Africa, but to the rest of the world, because I believe the challenges we face around healthcare, whether it's access, whether it's affordability, are similar across the board. And so if you're able to find one jurisdiction, chances are that it's scalable. But back to this issue of data protection and privacy, what we've done is to, again, understand what are the risks, beyond theft and, name it, manipulation. What is it that is at risk that everyone is worried about? And is there a way we can provide instruments that allow for us to address some of these risks? And this approach is something that we used even when we were putting in place the drones regulation, the performance-based drones. Globally, there was no, piece of legislation that, talked about how to regulate drone, kind of use case applications. But because as a country, we decided we wanted to be a proof of concept, we wanted to onboard emerging technologies to solve some of our society challenges. We had to even say, what are the risks around flying drones to deliver some of these services? And how do we allow the providers to bake into their solution, ways on how risk mitigation measures on how they can respond to this. So a similar approach has been taken for our data protection and privacy law. Now, just pick out one thing that was always a sticky issue, which was around data sovereignty or residency, where, like many countries, the preference is to host data. Again, if you're talking about multinational corporations, I mean, if every country is going or jurisdiction is going to ask them to host data locally, that's quite a huge investment for them to undertake. And so we toyed with ideas from, do we whitelist countries that have a similar regulatory framework like ours, where we're comfortable? But what we had to do was figure out a mechanism that would allow us to, on a case-by-case basis, allow for many of these operators, many of these private sector, technology providers to once they test they bring their technologies in Rwanda, give them an opportunity, of course, based on what they need to host elsewhere, to have a framework through which that can be done. But I think what's important, again, is the idea of education and sensitization is going to be key around how you balance regulation and innovation. People need to understand, what am I giving up and for what purposes. They need, it has to be a common goal. It can't be something that only technology providers are working so hard to prove to the people and the government, but I think it's a concerted effort between the government, the technology providers, and even the citizens that already understand, to sort of like, sensitize everyone to understand what does it take, what are the risks, and how do we, how do we go around them. So that's why I wanted to pick out on some of the questions that you are asking.
Yeah, I mean, on that point about being a test bed, how do you ensure that, you're not portrayed locally or even outside the country, but mostly locally, because that's who you should be most concerned with, as like, oh, things are being tested here, that, how do we know it's good for us, and are we being used as guinea pigs? Do you ever get any of that kind of pushback locally? Is there any sort of that concern, or is that something that you, to your point about sensitizing people and educating them, that's something you put a lot of effort into?
I think the starting point has been that there's been a very strong social contract between the government and the Rwandan people. But I think that is only possible because when you come in as a technology provider and you say, I have this, very good technology, this is what it can do, it has to be tested against, is this a challenge that we're facing as a country, as a society, that we need to address and respond to? So we've been talking about drones. When Zipline came to Rwanda, they wanted to use drones for last mile delivery for courier services. But that wasn't an immediate and urgent need that we had in Rwanda. What was immediate and urgent for us was, how do we deliver blood products to these healthcare facilities that take it to do that. And so we told them, so if you can deliver courier, do you think you can deliver blood? Because for us, this is where we feel there's a need. We will save lives. We will, we'll reduce on wastage, because what would happen as a government would then have to invest in cold room infrastructure in every healthcare facility across the country. You can imagine that's an enormous investment that we needed to take on. And so we went back to them and said, we love the technology, we love what it can do, but can it do this? Can it help us to save lives? Can it help us to deliver blood? And so they had to go back to the drawing board and figure out what was best. So even when we say we're a proof of concept for digital healthcare solutions, we're a proof of concept for fintech or agri-tech type of solutions, whatever solution that comes has to come addressing an actual challenge that exists. Because if it doesn't, then we're not able to create impact, but also the fact that as a proof of concept country, what we want is scalability. If you're addressing a challenge that doesn't exist, then scalability is not there inevitably. Like, you'll be able to scale to a country where you haven't proven that it's actually working and creating impact locally.
No, fantastic. Thank you for that. I want to go to Minister Rao just to talk about, again, that same question about data and data privacy and security. What are the challenges? What are the peculiar challenges that you have in India as a whole? Not just, I imagine, not just for your state, in terms of the way you approach this, particularly with health data.
Well, in fact, very recently I had a very interesting conversation with Satya Nadella, who's the CEO of Microsoft, and who also happens to be from my city, Hyderabad. We were having the same conversation about on this very topic, privacy. He said something very interesting. He's a man who leads one of the largest technology companies of the world. He said he expects global rules for data safety and privacy. He said, like how we have the World Wide Web and Internet Protocol, which kind of has become the benchmark of sorts, for governing all kinds of protocols for Internet across the world, across, the planet. Something very similar on, data privacy and security, Internet safety, in fact, at large. Is something that he was rooting for. In fact, he went on to say, when in this conversation, that he would like to ensure that each and every technology company, it's not the job of governments alone to literally ensure that, we protect, the data of our citizens, the data of our, people, but it's also the job of the designers from an engineering perspective, to build and design into our ethos to ensure that privacy, security, AI ethics, and internet safety, all of these are inbuilt into design. But what's more important, like I've been pointing out and like I've been saying, irrespective of where you're from, because we are at the Global Tech Governance Summit, I think irrespective of which part of the world you're from, you ought to be having a protocol which is guiding all of us basically on data security and safety, because I'm constantly worried, Inka, because I've quoted this example in the past, I'll say it again. I had bought a pair of shoes for my son recently, and they had an inbuilt chip, which kind of measure how many steps you take. I'm also using a Fitbit here, which measures my heart rate, my stress, and a bunch of other things. But I'm also equally worried on how intrusive and how pervasive it has become. So therefore, I think a global protocol of security, of privacy, is something again that potentially can have the genesis from the Global Tech Governance Summit at the WEF, and the WEF actually could take a pole position on this and possibly come out with an idea on how to create a benchmarking kind of a policy in ensuring that all of us adhere to these, all of us work on that. Having said that, also I had one quick thought, when I was rooting for universal health records, I do know I'm very conscious that each of the countries, each of the states, we are governed by completely different set of sensibilities, different set of guidelines, and different set of ideas. But I am also equally conscious that, as humanity, when we are, facing a catastrophe such as a pandemic, I think it is time for us to raise above all of these, artificial boundaries that divide us and unite together. Because, I don't think this pandemic has spared any particular nationality or any particular race. No. It has affected all of us, and it has affected all of our economies. So therefore, I think there are times when humanity has to rise together, and a platform like this only can be created by, an institution such as the WEF or the United Nations. Only then it will be accepted, and only then it actually can be respected as well.
Well said. Well said. I think that's something, again, like I said, I want to get into a little bit if we have time, but I think it's always important to hear the partner's voice on these topics, because a lot of these issues require, some of these ideas are developed, in fact, by partners and presented to governments, and they're absorbed from there. So, Professor, I wanted to really hear from you on this, because you brought it up first, data privacy, and really how you think, what are sort of, if you like, your best practices that you, when you're working with governments or leaders, how you advise on how we approach this as we get more and more, as technology, regardless of whatever we call it, there's going to be more and more technology in our healthcare systems. So how are you advising governments to be ready for this?
So first of all, I will say that I fully agree we would have handled the pandemic better if we had shared data related to health across the globe much quicker and much more openly and much more honestly. And in order to do that, there's also the issue of governance, of good governance on how to do this. And so the important thing is that there must be trust in how such data is shared, and also to take advantage of AI or machine learning, from which we can really learn a lot. So if we have a pool of health data, we can become so much wiser if we employ these newest technologies on that data. But I personally do not trust anybody that may have access to such data, say, in a cloud. So I believe that the right way to do this is through encryption. So to develop methods by which private data can be encrypted, can be shared in a cloud, and on that cloud, on a huge, huge data set, possibly originating from many countries around the world, then one can use the newest algorithms from machine learning, from AI, to become wiser on the pandemic, for instance. But the key issue is really the privacy. How do we ensure the privacy? And so possibly it could be through encryption. And here, of course, there are technologies available. But once we have the quantum encryption, of course, it will be better. But already now we can do it, I believe, by using the most recent technologies. Also, I think we must be aware that the interests of private companies may conflict with the interests of the population and the governments, in that the private companies may have a commercial interest, whether the governments must protect the individuals of the country. And for that reason, I think that we should be careful with these public-private partnerships. Of course, they should be established, but one must really be aware of the fact that there are conflicting interests. And when data is shared, it has a value for a commercial company.
Yeah, I mean, this is a thing that won't go away. I think we're going to keep on. I think we're going to keep on debating this for a while. I've made aware that we're coming very close to the end, and I've been so engaged with this conversation that I have lost some track of time. There was one quick question I wanted to very quickly just give, like sort of 30 seconds for each minister, from the audience, which asked how your country or state attracts the right technology solutions that take into consideration unique local needs. Minister Ngabire, we'll start with you very quickly.
Thanks, Inka. I think I sort of touched on this in my last intervention, where I did mention that essentially what happens is that we will know the different sets of challenges we have as a country. We will have multiple, whether it's an investor or an innovator from outside the country or even locally. When they come to us with a solution that can, they already thought through what are the kind of challenges that it could solve. What we typically do as a ministry that is in charge of technology and innovation is to work with our counterpart agencies to understand, do you already have a similar solution in place that is responding to this kind of challenge? Is this a challenge that you're trying to address? Is there data that needs to be collected by this technology provider? And the right technology to really respond to the challenge? Or could we find a better technology solution that can respond to this kind of challenge? So there's a process and framework through which we go through to analyze what is being presented to us vis-a-vis the kind of challenges that we are trying to solve. Now, for some of them, they may not even need to be coming to a government entity. If you're solving a ride-sharing problem, you know that it's a need. You know what, if your market is the population, you've done a survey and it makes sense, then we also engage to see how we can support. But I think what I wanted to communicate is that we have a systematic approach of understanding here are the challenges that we are facing. Here are the challenges, whether it's in agriculture, in healthcare, in finance, in education, and what are some of these technologies that can come in support. But I think very quickly to close on this, being a proof of concept, I think what's important is understanding that we are always open to testing and trying multiple solutions. So it's not one thing or the other. And so at one given point in time, these solutions addressing a problem of access to quality education, and we'll figure out along the way which one is giving us the most impact, and then scale more widely on that one.
No, that's great. I think we've got we're gonna have a close, because I think this is going out live, so we have to stick to the time. Sorry, Mr. Rao. We're gonna have the Kay Firth Butterfield, head of the AI platform, to give a brief closing message.
Thank you. Thank you to all of our panelists for this really riveting conversation, which, as our moderator said, just disappeared. I don't know where the time went. It was such an amazing conversation. I just want to finish by inviting all of you who are listening to join some of our work at the World Economic Forum on AI and data, which was also talked about here. And also perhaps to think, if you're interested in wearables, about joining our wearable data troves conversation at 3:30 Pacific today, for a piece of work being done by the IoT team. And also the Minister in Gabare mentioned that we were doing some work with them on chatbots reset. That's chatbots for healthcare. And again, that's something that we have just piloted and are now piloting with Rwanda. So again, an opportunity for you to join the conversation and join the work that we have to do in this multi-stakeholder fashion around governance of technology so that we get it right for everybody. Thank you so much for joining us today.
Thank you.
Thank you.
Thank you to all our panelists.
Yes.